Hello everybody, this is Dr. Bob and Dr.
Kason DeMaria.
And we are here excited. We have our friend with us, we have a fire extinguisher, lots of wonderful props. And what are we going to talk about tonight?
The adrenal glands. So why don't you tell us what are they and why are they important?
Well, I'm going to tell you what, we're going to peek inside of our little friend right now. Here are the adrenal glands. The adrenal glands are located on top of the kidney, but I don't know if you remember from anatomy class, this was like a long time ago for me. The adrenal glands are not connected to the kidneys. They are adrenal. They're above the kidneys themselves. So here are the two adrenal glands, and they are amazing in what they do. They create hormones. There's three basic ones. A mineral corticoid, which helps your body reabsorb minerals. That's quite interesting. If somebody like you comes into our office and say, Dr. Bob or Dr. Kason, I was just bending over and I picked up a pencil and my back went out.
We hear that often, by the way. Or I was bending over to pick up my grandchild and now I can't get back up. I'm laying on the floor.
And I'm shifting and I haven't walked in 3 days. So that's one. It's a mineral corticoid. Another one is a glucocorticoid. That has everything to do with sugar, and let me tell you, that is the reason that we see so many patients in our office. What is this right here?
Sugar.
This is sugar. This is like the amount of sugar that's in a soda. So here's what happens with sugar. Sugar basically places a demand on the adrenal glands, using up all of your cortisone. So we have mineral corticoids, we have glucocorticoids, and then we also have sex hormones. So you could have someone that comes into the office and their body is totally exhausted because of stress. Because what happens is that you're using up all of your cortisone and all of your sex hormones are depleted. And so we have issues with that all the time in our practice. Isn't that amazing?
It is.
So you're going to talk about some of the body signals?
So we're in Dr. Bob's Guide to a Healthy Marriage. And I'm on, if you're at home following along, I'm on page 119. So what we're going to do is I'm going to go through some of the common body signals that you could be experiencing right now that you might not even be aware of, that are because of these adrenal glands not functioning optimally. So do you have difficulty waking up in the morning? So a raise of hands out there. Give us some hearts or hands over
we
there.
Want to see a lot.
Thumbs up. Okay. What about you out there? Do any of you have sugar cravings? So
everybody is raising their hand. I can feel a windstorm.
I can see the little donut emoticons over there.
Yeah,
so,
all the little tricks.
Also, digestion problems. A lot of people don't realize that could be a sign of not having proper adrenal gland function. An afternoon slump between 3 and 4 p.m. What's that mean, Dr. Bob?
Well, their blood sugar is dropping for sure. People are having their candy bar, going to the soda machine, and they're hitting it, and the soda's dropping down, getting this, which is not healthy for them.
Negative outlook on life. So any of you out there that are moody, or on here also, Dr. Bob, you're increased PMS. So some people, when they come into our office, they're elbowing their mate when we're starting to ask these questions.
They have allergies too.
Allergies, decreased productivity, so difficulty with concentration, focus.
Can I interrupt you for a minute? So
Yes,
if it's
you may.
allergies, that means there are people that will come in during the springtime, they'll say, this is so funny, the pollen's in the air and my allergies are bothering me. And we look over into their purse and you see a bag of M&Ms. You know, you could be Claritin free, and it's your adrenals that are exhausted. Okay, what else you got there, Dr. Kason?
Symptoms worsen if meals are skipped,
okay,
as well as brain fog, poor memory, or if you feel better after you eat dinner.
Because it impacts their blood sugar. Anything else?
You may always, you need to be always moving or else you're tired. I know a lot of members that come into our office and they're sitting there in our educational area and there's all this excitement going on and they're sleeping.
I know. There's someone that was in there today.
I saw someone today too, and their wife said, hey, are you ready to go? And he said, oh, I'm ready. I said, were you meditating? He said, yeah, but the funny thing is I can't tell you what I was meditating on. So very interesting.
You know what else? The most common are people wear sunglasses. And so, I don't even own a pair of sunglasses. Only sunglasses I own is not even owned, but I use them for props that I got for free. So if you wear sunglasses, we have nothing against sunglasses, but if you go outside and you have to look for your sunglasses, see what happens is your adrenal glands, when they're working, cause your pupils to get small. It's what we call a sympathetic nervous system response. So you go outside, and if your adrenal glands are working really good, your pupils will get small and bright light won't bother you. But most people go just like this immediately. Where are my sunglasses? You know the sunglasses industry is like a multi-gazillion-dollar industry, all based on adrenal exhaustion. If you crave any kind of salty food, so the adrenal glands, I mentioned the term mineralocorticoids. This is some Celtic sea salt in here. This is our grinder. The Celtic sea salt minerals are important for your adrenal glands, and one of the nice things to do during the day, if you're noticing that you're craving, it really is that you're craving minerals. And a lot of times when people are craving sugar, they're really craving minerals, Dr. C. So people love, that's why I think people like fast food so much.
What's interesting is too, I had someone today actually, and her pupils were very large. Big, large pupils, and I asked her, do you crave bread? And she said, I love carbs. Do you want to talk about that with the adrenal glands, with the pupils?
Well, it has everything to do with this glucocorticoid. So I posted a few minutes ago, so as you're watching this or after you're done and then you're going to pass this on to your friend, I want you to look at this steroid tree. So cholesterol becomes something called pregnenolone, which becomes progesterone, which goes down to become cortisone. So what happens when you eat these carbs, you're using up all of this cortisone, and then what happens, your body has to make more minerals, and so you're constantly craving. It's kind of like slapping a horse. But let's talk about this cortisone just for a minute, because this is such an important part of what we see in our practice with inflammation. So I'm going to need you to hold that prop up here in a minute. So when you eat sugar, sugar is fire. So when you eat sugar, you're causing inflammation in your body. So this is a fire extinguisher. And what the fire extinguisher does, it puts out fire, but that's what cortisone does in the body. It's kind of like it's your water. So, okay, let's bring this back home again. Okay, so cortisone puts out fire. When you eat sugar, you have fire. So all day long, your body and your brain is hearing fire, 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 fire. Because I know that we can do what we call a mineral tissue analysis in our practice. And I am telling you, every time that we have people and we take hair, or you take hair in the comfort of your own home, we send it to the lab, it really is forensic medicine, but we don't tell people that. We're doing a mineral tissue analysis. If your sodium and your potassium are low, it's adrenal exhaustion. And these people are tired.
Also, people who their blood pressure, it drops from a sit to a stand position, and we do that in our office. We take our members' blood pressure sitting, and then we take it standing. It should stay the same or increase.
Yeah.
But most people, I mean, that we're seeing, because they have so many things going on in their life, their adrenal glands can't take that demand, and they're craving salt, and we're seeing all these different body signals in their body.
And they cry easy. We have a lot of people who cry easy. It's a sign of body signals. Let's get some thumbs up. Throw little hearts across the screen. We love it. You need B vitamins. The mosquitoes like you. Sore muscles after exercise. All body signals, Dr. Kaysen.
Increased heart rate.
Yes.
Heart palpitations. Need for Celtic sea salt.
You know, let's talk about another thought that just kind of came to my mind. So here are the adrenal glands. We have noticed that people who are chronic asthma, chronic breathing problems could be adrenal gland exhaustion. So if you come into our office and you don't smoke, but you do eat sugar, it can cause breathing problems. And it doesn't make any difference what age you are either. What you got there?
Stress in your adrenal glands. So how are your adrenal glands affected by stress, which I know you had touched base on, but how can we limit stress in our life? This is the magic question, Dr. Bob.
The magic question, how to eliminate stress. When you see somebody call up on your cell phone and you don't want to talk to them, don't answer it. I'm just trying to be honest with you. So, you know, some of you need to get some new friends. So you can say, really? We know so many people that come into our office, and don't any of our practice members take this personally, but a lot of people come in and they're not happy. and we know that you're not happy. So if you're in pain, that impacts your adrenal glands. And it comes down to this, the sugar and the stress. So if you're not happy with your work, maybe it's time to get a new job. So you're really going to have to confront whatever's going on inside of your body. Everybody should be happy. Can we get some thumbs up and some love going across?
Happy faces,
happy faces. Smiling, happy faces. What else you got there?
So what can we do to improve our adrenal glands health today? And I think that going back to the adrenal glands, we have a lot of members that they come in and people are saying, I think I have adrenal fatigue. Or I read about this adrenal fatigue and I started taking all these products, and what do you think about this and what do you think about this? So what's just simple things that people can do about supporting their adrenal glands, because they know they have stress and they could be consuming sugar and different things.
Well, you know what? We have stress. We get up very early in the morning. It's late at night right now. All three of us, Dr. Anthony's working with the camera right now.
Thumbs up for Dr.
Anthony. So we put time in. I rode my bike this morning before some of you were even up, and I didn't get into bed last night till late because I was just traveling. So anyways, you want to be in bed by 10 o'clock, before midnight for sure. You want to make sure, this is going to be very interesting and probably one of the biggest challenges we see with people. You want to minimize fruit. Many, many years ago, I read a book that talked about fruit placing a demand on the body. So you can say, but Dr. Bob, I love fruit. I know. Most people that come into our office love fruit. So we're just going to suggest you focus on eating vegetables and protein, getting to bed early, back off on the sugar. You have to have sleep. You know what else, Dr. Kaysen? You don't want to be exercising late at night, because you don't want that cortisol level increase before you go to sleep, because you will have a hard time falling asleep. And people who have adrenal stress have a hard time sleeping.
And simple, increasing this Celtic sea salt into your life. Breakfast, lunch, dinner, your water. It's a great addition to what you're already doing.
So also with the adrenal gland, there's a muscle in the body called the sartorius. It's always a test question when you're going to school. It's called the Taylor muscle. It goes from the front part of your spine, your pelvis, down to the inside of your knee. And one of the reasons that we see chronic low back pain is that sartorius muscle works with the adrenal gland. So you could have chronic low back pain because of adrenal exhaustion. Isn't it amazing how powerful the adrenal glands are? And I talk about it it affects your marriage. If your adrenal glands are tired, you could have low libido, no desire for intimacy. You could have pain. You got fibromyalgia. I mean, you're not going to get intimate if someone always has pain, right?
Right.
I know they're going to say, tonight I'm
I have a headache.
Oh, I think this should go viral.
So, how can we find out more about a healthy marriage?
Well,
how can they get this?
Well, very easily. You could go to our website. We have the www.druglessdoctor.com, and we have TV programs that we did on the healthy marriage. I think that would really help make a huge difference. But as far as even the adrenal gland, there's something that we do in the practice called the Adrenal Stress Index, which is a saliva test. Dr. Kaysen mentioned earlier, take your blood pressure sitting and standing. Anybody can do that. If your blood pressure drops, you should call us. If you crave sugar, you should call us. If you have a B vitamin need. Now, this is a really important this is a really important Facebook Live, because it really impacts people. We're going to have another tremendous program next week.
Wednesday night, so that would be on
Wednesday at noon.
Wednesday at noon, yes. Wednesday at noon, which is March 7th, we're going to be doing our Facebook Live from our Halfer to Health on a drugless approach to anxiety and depression, which is so prevalent now. And if it's not impacting you, 5 people that it is. So I encourage you, have them watch us. We're going to be live at noon next Wednesday on March 7th. We'll be live in our office, in our Westlake office. So if you're located here, come along, bring friends, and I know we'll repost the video, but this is going to be something tremendous that you can do naturally to take care of your body, your brain. I know chiropractic is a huge aspect in all of this that we were talking about today, because right after a chiropractic adjustment, it helps the parasympathetic nervous system, which is what allows your body to rest. And I think so many people today that are looking for that stillness and rest in their life, and they don't know what to do.
So pass this on. Look at the steroid tree like we talked about. The book will help make a difference with your marriage. throw out some hearts and some love to us. Pass it on. We're here to make a difference for everybody. We'll see you next time.